Recently established partnerships between pharmaceutical and telehealth companies have led to questions about the potential for inappropriate prescribing and unnecessary spending. Some of these relationships involve pharmaceutical companies directing users to websites run by telehealth firms, where clinicians are available to prescribe medications. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Erin Fuse Brown, a professor of health services, policy, and practice at the Brown University School of Public Health and a member of the journal's Perspective Advisory Board. Professor Fuse Brown has co-authored a Perspective article about pharmaceutical telehealth partnerships. Professor Fuse Brown, what do these arrangements between pharmaceutical and telehealth firms generally entail, and how might a consumer encounter advertisements for these telehealth prescribing services?
These pharmaceutical telehealth partnerships usually entail a combination of a consumer-facing website, usually hosted on the pharmaceutical company's website. Pfizer has one called Pfizer for All. Eli Lilly has one called Lilly Direct. And if a consumer were to go to one of these websites, they are able to follow a set of prompts to book a same-day doctor's appointment through a telehealth platform to be evaluated and potentially prescribed drugs from that pharmaceutical company for any condition they might have. And there are particular conditions that are targeted. The platform allows, again, the sort of seamless access to these telehealth providers through a scheduling and appointment link, as well as often some copay coupons or other types of incentives for consumers who are looking to use the pharmaceutical company's products. These consumers might also have found out about these platforms through targeted advertising. But increasingly, these platforms, including the telehealth companies themselves, not just the pharmaceutical companies, are advertising these on social media platforms, such as through TikTok or Instagram, and often using social media influencers, not just traditional online direct-to-consumer advertising.
So, what are the potential benefits of this sort of pharmaceutical telehealth partnership?
So some of the benefits of these types of partnerships are the potential for increased access. There are some concerns that in general, some people, because of where they live or because of how difficult it is to find appointment times with providers, may not be getting the prescriptions they need to manage their health because of the lack of access. And that telehealth can provide sort of a bridge to provide better access to people who may have, again, they live in a rural area, they may struggle to get the care that they need in their area, or they may just have long wait times, or they feel maybe stigmatized because they have a condition that like obesity that they feel a little bit concerned about scheduling an appointment. So telehealth has the potential to provide some additional access, and so there is some benefit to potentially providing easier access to these prescription drugs in the comfort and convenience of the patient's own home.
And then the flip side, what about the potential harms, both for patients and perhaps for the healthcare system itself?
I think the harms, the concerns that are raised about these partnerships is it that the increased access might make it too easy for patients to get prescriptions. And there are really two concerns. One is that for the patient themselves, that there is maybe an incentive to kind of quickly get them through the process and get them the prescription without necessarily providing the adequate level of evaluation, follow-up, or other types of clinical care that might be needed in that circumstance, so that they may be sort of provided care without adequate evaluation. The other concern is for sort of healthcare spending and for the taxpayer, and that these, by lubricating the ability for these patients to get the prescriptions that they want, that it might lead to unnecessary spending through brand name drugs for which there may be a cheaper or better generic alternative. Or there may be some incentives for these telehealth providers to provide the sort of the branded drug of their partner, but not fully evaluate the range of options that might be available to the patient that might be better suited for them or just cost less.
You say in your perspective article that the key law governing these relationships in the United States is the federal anti-kickback statute. So, what types of behavior are prohibited under that law?
The federal anti-kickback statute is a law that was designed to prevent and penalize financial incentives between healthcare companies for patient referrals or other types of arrangements that encourage utilization of the healthcare. So it prohibits any company or any person from offering or receiving any compensation, remuneration, or anything of value, really, in reward for referrals for items or services that are reimbursable by Medicare or Medicaid or other federal healthcare programs. And so the whole idea of this statute is again to put some guardrails around the types of financial conflicts of interest that might encourage clinicians to make decisions that are not, again, in the best interest of the patient, but because they have a financial interest or that they may get something out of value from that prescription or that order. And so the anti-kickback statute actually imposes liability on both sides of the transaction, both the person who's offering the remuneration and also the recipient of the remuneration.
How could regulators determine whether these partnerships violate that statute? What kind of evidence would be needed?
The clearest case of anti-kickback statute violation tends to revolve around direct payments for referrals. It's sort of quid pro quo that's in a very direct sense. So, for example, if a pharmaceutical company were to promise a telehealth partner, we are going to pay you for every referral or every prescription that one of your clinicians writes for our products, you will get a payment. That would be a clear kickback, and that would violate the statute. So, of course, these pharmaceutical telehealth arrangements naturally are going to be structured in a way to avoid sort of the obvious violation of this. And this requires a little bit more evidentiary digging. So basically, the real question is whether or not there is a financial relationship between the pharmaceutical company and the telehealth partner that is designed in some ways to, or intended to, again, reward the telehealth company for making prescriptions for the partner's product. And the telehealth company, of course, is getting a bunch of referrals in the process. Like every time a patient clicks on one of the links on the pharmaceutical company's platform, they're directed to the telehealth company's clinicians, and that's a referral. So it's the exchange of referrals for prescriptions that would need to be evaluated. So does the prescription rate for that partner product jump after the partnership is put in place? Is there sort of a disproportionate number of prescriptions written for the partner's product versus other clinical equivalents that might be a different company's product? So I think there are lots of things about the actual types of clinicians' patterns of prescribing, as well as their patterns of evaluation, whether or not the patients are being evaluated properly, whether there's contraindications, whether they are being directed toward other clinical treatments that are not the partner's product. So I think that these are all sort of individual, factual, additional things that we would need to know, as well as the actual nature of the financial relationship between the telehealth company and the pharmaceutical partner to fully be able to evaluate whether or not the anti-kickback statute is being violated.
Finally, what policy or regulatory changes could be implemented to increase transparency or to limit the potentially harmful behavior related to these partnerships?
I think there are a couple things that could be done. The first is something that the OIG could do, frankly, today. The Office of Inspector General of the Department of Health and Human Services often puts out fraud alerts or other types of guidance that educates the industry as to what types of conduct or arrangements it thinks are potentially very problematic under the anti-kickback statute. And it did put out a telehealth fraud alert a few years ago, but it wasn't specific to these telehealth pharmaceutical company arrangements. And so it could provide some guidance as to what types of arrangements that exchange value between telehealth partners and pharmaceutical partners that would be, in the OIG's mind, raising additional risks of violation of the anti-kickback statute. So that would be helpful because it would at least provide some information and guidelines to industry to get a sense of what the enforcers are thinking would be potentially very problematic versus safer or less risky arrangements. In addition to that, I think that there would probably be some value to providing a bit more information about the nature of these financial relationships we already have a disclosure requirement for the Physician Payment Sunshine Act for arrangements between pharmaceutical companies and individual clinicians. And so to extend those to these types of pharmaceutical telehealth arrangements as well, I think would provide a bit more information, at least to regulators, to enforcers, and to researchers, and to the public about the nature of these partnerships. What is the financial arrangement in particular that is being agreed to when a pharmaceutical company partners with a telehealth company? And then finally, I think that there is some concern that these social media ads are dodging some of the requirements that the FDA places on prescription drug advertising for pharmaceutical companies, because a lot of times these ads are not made by pharmaceutical companies, but they're being promoted by the telehealth provider company. And so they can use things like influencers or make claims about products in a way that is probably a little bit more, again, unlikely to, for example, include disclosures of risks or side effects or any of the other things that pharmaceutical companies are required to do. So I think a successful policy response will probably entail stronger and more clear guidance from the Office of Inspector General about the anti-kickback statute's applicability to these arrangements, as well as some tightened rules on pharmaceutical advertising when it's being done by the telehealth partner.
Thank you, Professor Fuse Brown.